Hello all, it is the top of the hour. This is Laura Young from the Department of Psychiatry at UT Tyler Health Science Center and the CPAN program, the Child Psychiatry Access Network. Thank you for joining us today for our session, Out of Control Kids, How to Advise Parents. I have with me two of our child psychiatry fellows, Dr. Pervez and Dr. Chapman. They will be introducing themselves here shortly and facilitating today's session. During the session, if you have questions, I encourage you to add them into the chat. And we will then also be answering those questions towards the end of the session. You will find on your screen a QR code, and if you are wanting credit for this session and you're either a physician or an advanced practice provider, either a nurse practitioner or a PA, you can get that through our Cloud CME mobile app by using that QR code or texting that phone number. However, you will have had to set up your account with Cloud CME ahead of time. If you have any questions about that, you can reach back out to us and then we'll get you connected with our CME department. So thank you again for joining us. I'll turn this over to Dr. Pervez and Dr. Chapman to introduce themselves here, and then they will have the PowerPoint. I'm having a hard time there. Their PowerPoint that they will share with you as they go through. So doctors, I'm going to hand this over to you.
Thank you, Laura. So my name is Dr. Tina Pervez. I'm a first-year child and adolescent psychiatry fellow. I did my general training at University of North Dakota, and I have no disclosure of financial relationships. I'll turn it over to my partner over here.
Hey, I'm Dr. Chapman. I did my general psychiatric training at Texas Tech in Midland, and I am also a first-year child adolescent fellow in training, and I also do not have any disclosures of any kind, no affiliations, whatnot. All right, let me open up our slides and we'll get going.
Can you all see the slides?
Yes, ma'am, we're good.
All right, so I'm going to start off by going over a little bit about the out of control kids and how to advise the parents. And then Dr. Chapman will go over everything in more depth. So let's get started.
Looks like we have somebody that's calling in from a phone line that is not muted. So if you're calling in from a phone line, would you double check that you're muted, please? I am unable to mute you. Okay, thank you, Doc.
All right. So over the last little while, we've noticed that primary care providers have become vital in managing mental health needs in youth here in Texas, in light of the severe shortage of child psychiatrists. However, many of these primary care providers have very limited training in screening, doing the assessments, and taking care of the youth with mental health disorders. This professional gap is predominantly a result of the limited exposure in our medical school training and then compounded by the inadequate mental health resources. The lack of mental health resources has resulted in primary care providers being the first and only source of assistance for youth and families that are suffering from mental health or behavioral health concerns. I'm going to go over the objectives of this presentation briefly. Number one, we're going to describe the various causes of challenging or disruptive behaviors. Number two, we're going to describe the best approach to addressing these concerns with caregivers. So what are things that you can do, how you can help some of these caregivers. So we're going to go over a bit of and provide you with some techniques that you can utilize and address some of this. Number 3, we're going to demonstrate the various parenting interventions shown to be effective for challenging or disruptive behavioral patterns, and tell you how to identify some of these and what you can do. And then the last is we're going to formulate a structured approach to assess and address challenging or disruptive behavior, when to refer, and then, and to assemble list of evidence based on the interventions. Children and adults often express themselves behaviorally when they don't have the language to explain their feelings, thoughts, or needs. Sometimes they don't know how to express what's going on in their mind. And so sometimes we see some of this being expressed behaviorally. When parents and caregivers learn to listen to and understand the difficult behavior, they can develop more effective ways to encourage discipline, appropriate behavior, and positive coping skills. So it's really important to understand and to be able to recognize some of these behaviors that the kids have, or some of these children and also some adults sometimes display. Understanding the causes of challenging or disruptive behavior. Children with challenging or disruptive behavior, they may be acting out familial stressors and or difficult family dynamics. So sometimes the things that are going on at home, if there's domestic violence or there are other things happening at home, there are stressors of some sort, they may experience exposure to environmental or social risk factors that increase their likelihood to develop behavior problems. Or they may have more sensitive or irritable temperaments than other children. Sometimes we compare our kids to other people, but, sometimes the thing is that the children at home or the ones with the behavioral difficulties, they're more sensitive. They have these temperaments because of an underlying reason, and that's really important that we identify this. They may be experiencing mental health conditions or have developed challenges or disabilities. They may be feeling ashamed or guilty about their behavior. So understanding causes of challenging or disruptive behaviors. Parents and caregivers of children with challenging or disruptive behavior. They're often parenting their children the way they were parented, or are simply parenting within their expected cultural or religious parenting form. Sometimes they don't realize that they're in a different environment. We're in different times at this point. Earlier, there was no technology being given at such a young age. Currently, kids have their iPads or other devices that they're using. These are just some examples. Sometimes they may be struggling with their own mental health or developmental conditions, which need to be taken care of, and they just haven't been addressed for whatever reason. They may be unaware of child development needs and have either too high or too low or not enough expectations for their kids. They may be feeling overwhelmed, unprepared, afraid, ashamed, or guilty about their parenting and or their child's behavior. They may not have the family or community support they need, aka the village that we've all been familiar with, everybody talking about it. Support the parent, support the child. How do you do that? You approach the parent with respect. It's always important to tell the parent that what they're doing is right, because it's to the best of their ability, the best of their knowledge, the knowledge that they have, and then assume that they're doing their best. Consider bias, be open to understanding how you are feeling or thinking. We're going to talk about some of this. I'm going to give you an overview of some of the points on this slide. And then when Dr. Chapman starts talking about this during the presentation, she'll give you more in-depth information or knowledge. In order to thrive, all kids need responsive caregiving, attention and affection, clear and appropriate expectations and structure, modeling. When we talk about modeling, what is healthy boundaries? What's the importance of healthy boundaries? This is something that gives kids some freedom and autonomy to explore and develop a sense of identity. Understanding the meaning of limits helps children understanding and respect their own needs as well as the needs of others. As a result, they develop greater empathy and self-awareness. Then we have the healthy ways to express emotions. What are some of the healthy ways? We use positive self-talk as an example. Spirituality is another example. Being a good listener when kids are speaking or when they want to talk. Modeling emotional expression, practicing empathy, being able to forgive, practicing acceptance, Playing games with children, sometimes that helps promote emotional expression, being grateful, being optimistic, practicing mindfulness. So that includes things like meditation, yoga, breathing exercises. This is found to promote optimism, happiness, positive emotional state, and self-acceptance. These are highly encouraged. And then healthy responses to adversity. Building resilience by learning how to respond and to overcome adversity, embracing the optimism and positivity, decline negative feelings and thoughts. Some of the tips that I can give people are for building resilience in kids and teens. This is something from the American Psychology Association, and these are tips that they have recommended. Making connections, teaching the child how to engage with their peers, helping your child by having them help other children. They can feel more empowered by helping other people. Maintaining a daily routine. This can be very comforting for the child. Following a specific bedtime routine, waking up at a certain time, taking a break during the day, teaching your child self-care, which means things like eating properly, exercising, getting sufficient sleep, and then moving toward your goals. It's important to make sure that we're setting reasonable goals. They're age appropriate, things that can be achieved easily. Nurturing a positive self-view. So how do you do that? You help your child remember ways they have successfully handled hardship. So giving them examples of things that have happened in the past and talking about that. Keeping things in perspective and maintaining a hopeful outlook. Accepting change. These are some very important tips that are given on the American Psychology Association website, and they've been very helpful. We will talk more about this in depth, and I'm going to turn it over to Dr. Chapman, who's going to further explain this to you.
All right, that's me. So we're going to start with something called positive parenting techniques. Is that the one that they call triple P too? Positive parenting. It might not be. Anyway, it's something that was developed and found to be very effective in managing kind of kids that have troubling behavior. And so positive parenting techniques, we're kind of going to go into some of the basics that make up this training. And so first and foremost, we want to address the issue sooner rather than later. So the longer that it has time to kind of become a pattern, the longer it's going to take to address it and reverse that bad habit, so to speak. Even if that is a bad habit of expressing our emotions, maybe not in the most adjusted way. We want to establish a structured environment and predictable routines. So I tell the kiddos in my office all the time, as much as we fight it, even adults do better in a structured environment. We know what to expect. We know what's expected of us. We know what's going to happen next. And so the fewer surprises and the more predictability of that daily routine and that overall environment is going to give them kind of a sense of somewhat control over what's going on in their life, or at least comfort with knowing how things are going to roll. So make time for play and exercise, meal times, sleep hygiene, all of the building blocks for a healthy daily routine, and stick to it. So that becomes part of their internalized way of being also. Use visual schedules, calendars, or verbal reminders on how the day is going to go. So if they can kind of visualize what's going to happen, especially if they're one that tends to forget or kind of not be paying attention the first time, then they can always, if they're coming and repeatedly asking you, or if you're not available to be asked, they can always go see on the schedule. And then giving them verbal reminders is just an extra way of bringing their attention to what's going to happen next. So we're going to end playtime in 5 minutes. Okay, we're at 3 minutes, that we're going to kind of finish up playtime. And so they know that that's going to happen. There's less of an emotional reaction when suddenly we have to put the dolls away, or we have to kind of move on to the next thing that may not be as fun. And establish house rules and behavioral expectations for other settings and stick to them. And so this I really like too, because this kind of goes along with the structured environment. If we know that in our house we do not hit each other, then when we hit someone and that behavior is punished or that is addressed in the way that it is, we all knew that that was how it's going to go. It always has and it always will. And so that is kind of our stable house rule. Behavioral expectations for other settings are good also, you know. So like when we're in public, we won't be throwing tantrums, screaming, or invading, you know, other people's personal space. Now, actually, I just went the opposite direction because right after this, it says state them positively. So where I said when we're out in public, we're not going to be screaming and, you know, throwing a tantrum and invading other people's space. We want to state it positively as when we're out in public, we are going to use an appropriate tone of voice, follow the instructions that I give you, and stay next to me. And so we're not giving them as many alternatives. They don't have as many options of like, you know, if I'm not invading someone else's personal space, I can do this instead. And it also kind of tells them exactly what you're asking of them. And so they're more able to meet that expectation. And so all of these in the kids' life, they know this is how it's going to go. And it kind of helps with any transitions or difficulties that we may have emotionally, because this is the expectation going in. There's no surprises. This is how it is. I'm not saying it's going to totally avoid any tantrums or outbursts or anything of that kind, because things happen, but it's always good to have this as a base and a foundation to be working from. So give attention immediately and like specifically. So if they're behaving and they're playing happily and they haven't hit their brother for 5 minutes, be like, you are doing wonderfully at playing in a positive manner with your brother. You can be specific, tell them exactly what you like, what that they're doing. And, you know, spend about 5 to 15, I guess, depending on the number of kids and like kind of how things are rolling. But to give the young person control over what y'all are talking about or what game you guys are playing. And it kind of gives them a sense of control and autonomy, and anything that is coming up, especially if it's a conversation, anything that is bothering them, that gives them a chance to really voice it. So they feel seen. And that's kind of like building that positive relationship between you and the child outside of everything else that you guys do together. Learn to anticipate behaviors, reactions, and triggers in different settings or situations. And I know you guys know all of this also. You know, if we have patterns, for example, you know, some of our autistic kiddos have difficulty with transitions. And I mean, it's not all transitions. For some of them, it depends on the transition. So for example, I have one that has trouble transitioning from home to bus to school and then back at the end of the day. And we know that. And so we're able to anticipate that and kind of provide extra care and extra support in those transitions. I have a kiddo who that has trouble transitioning from class to class. And so we have an R&R break scheduled in. So to kind of like soften the blow of that difficult experience for them, because we still want them to be able to take part in their day-to-day and the full class schedule. But at the same time, there are some things that kiddos have trouble with. One kid will have trouble with and kind of have a breakdown, and then another acts like it didn't even phase them, you know? So everyone's different, and the better you're able to kind of anticipate, the better you're able to run interference and prevent it from getting escalated to the point of some of those extreme outbursts. Prepare in advance to prevent both parent and child from reacting in the moment. And so especially, for example, if a kiddo is coming in to a doctor's appointment, especially if it's their first one, and they're an anxious kiddo, like the parents will talk to them about it in advance, which can be a double-edged sword because there's some anticipatory anxiety that goes with it, but they kind of let them know, okay, we're going to have a different morning. We're going to go see a new doctor. It's going to be a new setting. What are your concerns? And they kind of talk about it together, knowing that it's going to be maybe hard for both because parents react to kids and kids react to parents. And so if we both together are on the same page, then it's easier not to react kind of to the other. And also just kind of having things to help, redirect the kiddo, or extra help for the parent if it's going to be a particularly difficult experience. Because I imagine getting blood drawn for a lot of these kiddos can be a little bit of a chaos. Give them choices, but not too many. So that's also my favorite, because you're giving them the perception that they're in charge, but you're giving them choices between two things that maybe you're down for anyways, So do you want to go for a walk or do you want to color? Instead of like, what do you want to do, which could escalate quickly or snowball to something that maybe isn't really on the board. We're giving them two options, but they got to choose. And so that kind of builds that rapport with them, builds that relationship, and they feel like they are their own tiny human. And then use planned ignoring, which more or less is, okay, we're throwing a tantrum because we didn't get a toy as a result of not meeting the expectation that we would stay asleep in our bed all night. And we knew that we weren't going to get the toy because we did not do what was asked of us. And so instead of kind of talking to them and giving them extra attention when they're having that tantrum, we are going to give them no feedback and no reinforcement. And so we'll plan to ignore that behavior. And what that does is it removes any kind of stimuli that's going to make them want to continue that behavior to get more attention. And that is also why we give them attention, and a lot of it when they are doing well, because that's reinforcing that good behavior. And you guys know this, but it's always good to like kind of talk over it again. Choose your battles. So if we are dealing with a kiddo and a parent or family that have a lot of different things, like they come in with a list of things that are really getting them. It's not reasonable to think that we're going to be able to check all of these off right now. Like we're not doing our homework, we're not eating our dinner, we're eating too much junk food, and we're not listening, and we're skipping school. Okay, that's a lot of things. And yes, they all probably need to eventually get addressed. But to actually give all of that attention to one of the problems and actually solve it in a constructive manner, we might have to compromise on some of the other things. And so, and also, some of those other things can be grouped as well. And so kind of knowing that just fixing one thing is a huge victory, especially if it's one of the biggest things, if it's one of the biggest factors that's contributing to the discord and to the fights, then if we get that out of the way, then everything else will be a lot easier. And that also like kind of starts a pattern of how we're going to address these problems. And kind of in that same note, problem solve with the child. And so kind of sit them down when neither of you guys are upset, not when we're at the peak of anger and we're like, okay, we need to deal with this. But like when everyone's kind of like at their normal baseline, bring them in and be like, okay, I've noticed that we have a consistent difficulty completing assignments. How can we make this work? What is it that you feel like is making it hard for you to do this? And then you get frustrated, and then I push you to do it, and then you yell at me, and then I yell back, and kind of bring them into it. Now, the younger the child, the more difficult it can be. They might need a little more of your input, but that doesn't mean they won't still have, their own opinion on how that they would rather be doing it. And oftentimes kids want to do what's expected. No one wants to get in trouble. And so it's kind of a way of finding out where they're having trouble so you can help them with that specific trouble rather than punishing them for having difficulty with something. Model emotional regulation, listening, helping, and following through. And so my favorite thing to kind of remind people who end up getting in yelling matches is like, you know, never raise your tone. It's hard for someone, it's not impossible, of course. It's hard for someone to continue at that high screaming level when the person who's responding to them stays at a calm and measured tone. So kind of just modeling emotional regulation, keeping the tone normal, not reacting when they are kind of pushing your buttons is the best place to start. Make it clear that you're listening to them. And again, like when you guys identify that problem that they're having, follow through on it and help them with it. And then that helps the child do the same. They watch you do it and they learn to do it for themselves as well. And so sometimes they'll start approaching the situation with, I've noticed I have trouble getting ready for bed, especially with the shower part. I think what's happening is this. And so you're kind of training them to come at problems like this, which is going to equip them to go forward. And these are all things that, like, you know, we're going to be telling our patients that have out of control kids, of course. And then support through the tough feelings. So love, like give them the like hugs, cuddles, listen to them, you know, be understanding, tell them that, you know, that absolutely makes sense, and breathe together. So my favorite thing to do when I'm teaching someone to do breathing exercises is do it with them. And they kind of, even like when I would see someone escalating kind of in that hospital or something like that, I would start breathing deeply and like slowly. And they invariably would end up following suit. But even if I couldn't get a word in, if I'm like doing that deep breathing, they'll start to kind of follow through. And so these are all like fun little pro tips from positive parenting techniques to kind of give parents to like let them feel like they're not completely in the lurch and there's nothing that they can do. Commands. So we want them to be age or developmentally appropriate. So if we're asking something from our kiddo who's 4, it needs to be something that a 4-year-old can wrap their heads around. And not all parents fully understand that, unfortunately. And so kind of giving them a little bit of education on, okay, when we're 4, we see the world like this, and this is as much as we can understand. And the opposite is true. You know, when we're a 16-year-old and the parent is telling you like the most basic thing, it can be kind of offensive and maybe lead to another outburst. And so making sure parents are doing this like in an appropriate manner as far as like what's being asked of them, and reasonable. Word it positively. So feet on the floor rather than stop jumping on the sofa, or you know, I want you to walk beside me rather than stop running. Things of that sort. Give them statements, not questions. So kind of tell them feet on the floor instead of why aren't your feet on the floor, or why are you jumping on the sofa? And so it's not a discussion. You're in charge. This is what you need from them. And so it kind of decreases the whole back and forth that some parents will kind of get pulled into. Keep it short, simple, and to the point. Again, it just makes it more clear. There's less of a back and forth that the kiddos can have. And so teaching parents to do that is also super helpful. Do it when you have the kiddos' full attention. So if this is a kiddo who's like here, there, everywhere, and we're giving commands, and then kind of it's going to escalate because the kid maybe caught half of it, if maybe none of it. And so kind of teaching parents to give these commands when like the kiddo is fully attending to you. And so some parents I know you know, they'll have to repeat and then they change their tone a little bit to get the kids' attention. My favorite one is some parents will go over and like make physical contact because it's a new, different kind of stimuli. Especially, you know, some kiddos will hyperfixate on something and they really don't seem to be processing the external sound of their parents yelling at them, or trying to get their attention or calling their name. And then communicate it with like a suit, like you don't want it to be too short of a time that this child is expected to do what is asked of them, but you also don't want to expect them to be able to remember and maintain, you know, compliance with that command for an hour if they're 4 years old, you know. So a lot of that reasonable things, and as you know, practitioners who work with kiddos, you are experts on this, and so kind of giving parents those high points makes, even like when they are giving commands, a more effective and efficient process. So punishment, we like this quote. The AAP recommends that parents do not spank, hit, slap, threaten, insult, humiliate, or shame to discipline their children. Research has shown that striking children, yelling at them, or shaming can escalate stress hormones and lead to changes in the brain's architecture. Harsh verbal abuse also is linked to mental health problems in preteens and adolescents. These kids take it to heart, and it affects them, and it also unfortunately can kind of show them how not to address the issue, like how not to address bad feelings, but they kind of follow suit. And so even the AAP, after kind of doing some studies, have shown that like this has a biological, like a negative biological impact on these kiddos and can really lead to some mental health problems. Whereas kind of sitting and talking to them, listening, helping, and following through is going to teach them to be the person that these parents want their kids to be. And so this is a very good, like, objective point of view when it comes to training parents not to punish. This is a very objective, you know, it's not shaming the parents or anything like that. It's just like straight facts. So I like that. The behavioral ABCs are also fun. And so it is kind of a way of, it's separate from the positive parenting, I believe. So I might be accidentally lying to you guys, but I am fairly certain. And it is kind of looking at when we have behaviors and kind of deconstructing, trying to figure out where they came from, because as Dr. Purvey said earlier, they're usually in response. You know, they're a type of communication. If we can figure out what they're trying to communicate, and like you know, as I kind of covered in some of the positive parenting techniques, identify and anticipate, then, you know, awesome. That's going to give us so much more information. And so the behavior is what a lot of the time we focus on. The other two are super important. So what happened before the child's behavior? For example, I have a kiddo who the antecedent was, I got a question wrong. The behavior was throwing things, screaming, yelling, kind of causing chaos in the classroom. And what happened after the behavior was mixed picture. So we would kind of be separated. Caregiver worked at the school, so they would get to see their caregiver. So that would kind of be reinforced, but what he wasn't getting was kind of a feeling of acceptance in the classroom. So it was a double-edged sword. And so kind of seeing what maybe our goal was versus what caused everything can clear things up a little bit. So if, like, in his example, he had a lot of trouble tolerating the frustration and disappointment when his expectation was he gets every question right. In another example, you know, we have a kid that it seems to be out of nowhere maybe the class was going on perfectly fine. And he was maybe a little agitated, but it was a busy classroom. And so what happened before, the teacher was attending to other students. The behavior was an emotional outburst. What happened after? He got an increase in attention from the teacher. And so the attention that he was wanting, he or she, I should say, was kind of given, unfortunately, through a negative behavior. And so kind of deconstructing those to figure out where we are, why we are doing this, and what we're getting out of it, even if as an adult we're like, that didn't really achieve much for you, you just got in trouble. I mean, these little creatures will take negative attention over no attention at all, unfortunately. And sometimes it is the antecedent that we want to focus on more. Sometimes it's the consequence, but either way, it kind of informs the bigger picture of the behavior rather than looking at it in a vacuum. And so we have a chart, which is nice, with what happened before the behavior, right before, what happened, the behavior specifically, and then how others responded. And it's a nice way to kind of log, especially at home with parents, kind of the full sequence of events to figure out what exactly is happening in the bigger picture of things. And sometimes they'll need you guys to help them with that. As a parent, sometimes it's not super obvious, but like, a clinician who knows the family can sit down with them and be like, what if maybe this is happening? Or is this consistently what is causing us to have a behavior? Then we can anticipate that situation and address it, as needed. So that is that. All right, how can our primary peeps help? You guys are the front line, and you kind of see them throughout their life, so you kind of sometimes know them before they even start having these troubles. So first, we always say assess. So it's always interesting if you get the parent and the child separated. It's always interesting to see the different information that you get. Sometimes I tell kids that like there's 3 stories. There's the parents and the truth, which is just to say that like everyone has a different perspective. And so if you kind of get everyone's perspective, you can see the bigger picture. And, parents get burnt out too, but also kids can be having difficulties that they're minimizing. And so getting that sussed out is a really good place to start. You are pros at this, but kind of just tapping back into your developmental knowledge, the social histories and the possible needs of the kiddos is important. There are a lot of behavioral health screeners that are super helpful. And I want to say that we have those listed in a subsequent slide, but I know that you guys are also familiar with a lot of those things, and it just kind of picks up on some like mood changes, ADHD, other underlying causes of maybe some of these out of control behaviors, so to speak. Seek to learn the function of the child's behavior. So, a lot of our culture, males get attention through negative behavior. Like they act up and they get the teacher's attention. It's just kind of a pattern. But it's not always that cut and dry. And so doing those ABCs too can figure out like what the function is. Or, if really we're not getting much out of it, we just have difficulty managing the frustration that's within ourselves. And that might be pointing to, some more like anxiety, like a diagnostic etiology. And then work with parents to track behavior. And so sometimes we have like an increase in behavior after we go back to school. I have one mom that was like, we have it mid-September and then we have it, right before the school year ends. And so when you can kind of figure out when that's happening or what, like kind of if it's happening in response to something, then it gives you a little bit more understanding of what the behavior's function is for that kid. When you go to address it, it's always great to listen, empathize, and validate, which you guys already do. It's, it must be frustrating having a kiddo that the school's always calling and you feel like everything you do doesn't work, letting them kind of vent it out and letting them feel understood, heard, and, that's okay that you feel like that. Anyone would feel like that. Super important. I think kind of supporting everyone who's going through it can be great and bringing them all together ultimately. Give the parent credit for asking for help. The first time I learned about parenting classes, I was like, are parents offended when you ask them to do that, which a lot of the time by that point, they're at their wit's end. So they're like, I'll do whatever you ask. But, the parent-child relationship, as you guys know, is a sacred one. And like a lot, if you want them to know that like asking for help doesn't mean that they're a failure. It really means that they're that much better of a parent. Coach them on those basic positive parenting concepts that we covered, and have them kind of fall back on those. And at first it can be hard, especially if we're one to be like, stop running, don't do that. No, to kind of reframe everything. But like anything, it becomes a pattern that we fall back on, structuring those days, reasonable commands, all of that stuff that we touched upon can really, again, make the entire situation a little bit better controlled for everyone because our expectations are set. And then providing verbal, written, or online parent education support. And so there is a lot of different things. And like they have you as a support system, but of course you are doing that for a lot of different parents. And so being able to provide them with that elsewhere and like kind of where they can kind of plug into more information, more knowledge when they feel like they're at a loss will allow them to elaborate and more specialize what they're going to do day to day with their kiddo. Referrals, you want to consider, is medication warranted? And a lot of the time you guys are completely like, you're like, yes, and I'm going to do this. And so when the referrals would come up as soon as you get kind of, I would say it's up to you. And I think it varies from person to person. And because a lot of the times you guys are the gatekeepers, but your knowledge in this, as far as like us getting kiddos that have been already kind of managed by their primary doctors is extensive. Like you guys know what you're doing, but do always feel comfortable asking for help. And when it does get to the extremes and you're like, it call CPAN or, refer out to us. But I know just the availability, unfortunately, it's limited in this region. Parent training. So again, I was like ready for some parents to get real mad at me. But a lot of the times parents are like, I'll take whatever you will give me. And so these are some evidence-based interventions. They've been studied. They've been proven to be very helpful. That's the triple P that I was thinking of. So positive parenting program. And so that was a really popular one, even from where I did my general training in Midland. It's extremely effective. Every kid is different though. And so kind of looking through the different ones and seeing what fits them. You can even kind of give them a list of these things. And if they are a parent that has a little bit more time available to them, then they can look through and kind of decide. But triple P is always a good one to start with. And like I said, you'll already be offering them a lot of the kind of pearls of wisdom from the positive parenting techniques. But these are some of our very nice evidence-based ones. So we have evidence to show that they're effective. Consider family therapy. It sees the family as a system. And I'm sure you guys know exactly what I mean by that, because like it's a give and take from everyone, not just mom dad, child, caregiver kind of thing, but there's siblings, there's relatives, there's, you know, grandma who has a strong opinion about this. There's a lot of different dynamics in the home. And sometimes that's what's kind of causing things to ignite individual therapy. And so like if the kiddo needs to have their own source, and I've found that as they get older and like into their early to late teens, like they don't want to talk to their parents as much about it. They would rather talk to like an objective like counselor or someone who's going to kind of give them that support and help change their point of view. If you feel like there's something developmentally going wrong, if they need like a psychological full evaluation, you're like, okay, I don't know if this is autism. I don't know if this is developmental disability. I don't know if this is, you know, something else. You can always refer them for evaluation elsewhere. At school, they have, especially if they're having a lot of educational problems, you know, referring them for FIE, which is full individual evaluation, is a really good way for them to assess their educational capacities and where they are needing some extra accommodations at school. And so that is kind of, these two come hand in hand. But at the same time, if you know this kid has ADHD and you're, you know, referring them for the FIE, you can in the same breath ask for some 504 accommodations or whatever accommodations they find are appropriate. And so making those references is always very helpful. And then wraparound services is kind of like a collaboration of all of these. And then we have physical therapy or occupational therapy coming to the house. It's a very, very much like it sounds. And a lot of our MHMRs and things like that are able to offer more of that. But I know that MHMR is not the only one that can provide wraparound services. And I am a recent transplant to the area, so you guys probably know better than I do about that. And these are kind of direct links to some parent, you know, training programs that we discussed on the previous page if they want to kind of plug right in. And just a general database for finding help in parenting for these evidence-based parenting programs. So today we're going to talk about, one of our supervisors is ill today, so I'm kind of going to jump in about one of my kiddos. So he is, I want to say 5 years old. And actually his difficulties are currently at school. He has a diagnosis of ADHD. And he is extremely intelligent and came to me when there were concerns that he was going to get kicked out of school. He's still very young. And so kind of getting him on medications was extremely helpful. He had been managed previously, but we kind of tweaked them and talked about some accommodations. Unfortunately, as school curriculum becomes more challenging, sometimes our challenging behavior becomes worse. He does also have a specific learning disorder in reading. And so he has specific classes that are one-on-one with some aides. And so we recently started kicking holes in the walls. When I asked what caused the hole in the wall to be kicked, it would appear that we got a word wrong when we were reading. So it kind of identifies what our trigger is, especially with dyslexia and his ability to do well elsewhere. It was kind of a distinct kind of trigger point that caused him to be angry. And when we returned to school after being suspended for a week, we had 3 tests that were to be taken that morning. And so we kicked another hole. And that is actually a pretty good example of kind of the ABCs, because the antecedent is pretty clear. It's like an educational stressor. And Like I said, he is a very intelligent young man, even at 5. And so he had a lot of trouble managing his frustration, and he reacted. And the consequence actually was that he got to be out of school for a week. And so you guys can kind of see the combination of things that are going into this. Luckily, his parents are very well engaged, and they're very capable of doing a lot of the things that we covered in the presentation. So it's more about kind of addressing it with the school to see, are we able to, one, make this a structured and expected day-to-day schedule with him? Are they able to anticipate what's going to cause him to be angry? And are they able to anticipate, obviously, that a behavior is going to follow? Because if we can anticipate it, then we can kind of mitigate it in a way as well. And so seeing what it looks like when he's getting upset, and then being clear with our expectations. He has not been able to be in like a full classroom because he's overstimulated. And so that has helped a lot. But if we have the adults around us and the adults helping us, kind of being more clear, having a clear routine, and having appropriate expectations, maybe shortening the time that we do reading, or kind of telling him throughout the reading experience, or when he misses a word, it's okay. I miss words too. We all miss words. And you're doing really good, especially for someone who has trouble with reading already. And so that kind of will help manage his reaction, which will help manage how many holes we have in our walls. And so I think that's just kind of like a really little tidbit, because I know I've already talked a lot. In the rest of the slides, just about kind of, we can see the antecedent, we can see the behavior, we can see the consequence. I'm actually reaching out and going to try to work with the school to figure out how to make the days more structured, how to make our expectations a little bit more important so he can stay in school, because a lot of the time, like, they want to do well. And so it's about seeing he's communicating extreme distress by an inability to read a single word. And so that's telling us, he has high expectations, he has some anxiety, he has some poor frustration tolerance, and that kind of also educates. And then just in the same breath as parents doing things, our caregivers at school are also important in how they do those things. And I know we have covered a lot of different things today.
Yeah, in addition to the counseling and therapy services in the community, you guys, I'm pretty sure, are aware, schools do have counseling and therapy services available within the school. If they say they don't, they do have ways of making those arrangements. And sometimes it really helps, especially I've had a 14-year-old who was being bullied, had a hard time expressing the issues that she was facing. And so we got her set up with the counseling service at school, and that counselor ended up being her advocate. So that was very helpful. So a lot of the times that really helps as well, in case you guys aren't aware about the services that are available in school. Yeah.
And I think what we want to do at this point, we need to have a few minutes to answer we've got some great questions, y'all.
Oh, awesome. I've been hearing them tick, but I can only see our slides.
Do you see them in your chat?
Let me pull that back up.
So the first, are you, if you can see them, great. If not, let me know and I'll read them.
Here we go.
Can we get a copy of these slides?
Yeah, absolutely. In your experience, does preparing parents for expected behaviors such as rejection, sensitivity, and ADHD help parents to empathize and create more positive solutions? Absolutely. Yes. I'd say a lot of what we do is like education, because a lot of what they're seeing is that reaction. And if they are the parent that the child didn't inherit the ADHD from, it's especially difficult for them to understand what might be a very minor slight for that child. And so kind of explaining not only that this is absolutely like part and parcel with ADHD, and that it is a consistent thing that we see. And this is kind of how we should expect to react accordingly. I feel like it kind of lets them understand a little bit more of what their kiddo's going through, and lets them see those reactions in a new light. And so they're not as willing to like antagonize or like give them a hard time, but more work with them to figure out how to manage what we're feeling right now.
The next one, is it okay to give rewards for positive behavior, like a small toy, occasionally a 5-year-old? Definitely, I think it really helps. Positive reinforcement is good. Using reward charts, doing rewards for little kids, you want to have a 3-day to 5-day interval where you would give them a small toy, and then like at day 15, they're looking forward to something big. That really helps, and a lot of the times we do encourage that in clinic as well, but making sure that with the smaller kids, shorter span, rather than 5 days, 3 days normally.
And with the little ones, I do have, I think he's about to be 5, that's doing it, and he and older brother are both doing it, and they had found an app. With the kiddos, sometimes it's easier to have a tangible thing like a sticker or like a physical token that they can have to see that they did meet that expectation. And so it might be variable. It might depend on the 5-year-old, but just something to kind of keep in mind. Guys.
A couple more questions in here as well. They were up a little bit earlier.
Oh, yeah. Let's scroll.
And actually, Erica asked, what's the differences between psychotherapy and behavioral therapy? I see those two terms used interchangeably. That's a great question.
I like that question. Do you want to answer it?
Do you want me? You can go ahead.
So okay, behavioral management therapy or behavioral therapy can vary a little bit. So in school, especially for our ADHD kids that are kind of getting in trouble for behavioral outbursts or behavioral dysregulation, they have available behavioral management skills classes that they'll pull them out into. But in the same breath, you can have a psychotherapist working on behavioral modifications with the kiddos. And so it's more of like a subset of therapy in which they're targeting behaviors and where they target certain behaviors that an entire group of kids are having when they're doing the school sessions, because usually it's a class. So it's more than one kid. And so it's more generalized. If you get them, into behavioral modification or behavioral therapy with a psychotherapist individually, they can kind of work on specifics that the kid runs into. And so it can be a little bit more specialized, but it's more of like a subset of therapy. And a lot of the time when we see psychotherapy, we think, talk therapy, but it can be all kinds of different things, especially with the younger ones. Talk therapy, they're not as able to really understand their feelings. And so it's a lot of play therapy and behavioral modification and things of that sort. But that is a good question. And it definitely confused me for a really long time.
I'm going to ask, real quick, I'm going to ask Meredith to show the physician screen, please.
Yeah.
Thank you very much.
So go ahead.
Yeah, ABA behavioral therapy is it? Yeah, it's for autism. Dr. Simmons just answered that. Yeah, so they learn skills and lessons, problematic behavior like hurting themselves or acquiring different skills. It is, different from behavioral therapy.
And I think it also is fairly specialized for the kiddos.
Yeah,
which is really nice.
One of the other things I saw in an earlier comment or question about using this as a behavioral health plan, and Jacqueline Mojica who is very familiar with CPAN, asked that question. She's a PMHNP up in Titus County. And so I don't know if Jacqueline's still on or not, or if she had to drop for patients, but what specifically were you if you're still on, Jacqueline, what were you specifically relating that question to? It must have been something within the early part of the presentation.
Was it mentioning the evidence-based? Is that what you were saying?
I don't know.
You can
I don't know if
email us
Jacqueline's
and
still
later
on or
on we
not.
can, yeah.
It might have been when I was talking about positive parenting techniques as being one of the evidence-based techniques for intervention, perhaps.
I don't know. It was about quarter after. So the question was, can we use this as their behavioral management plan? So Jacqueline may be able to follow back up with me, and Dr. Chapman, Dr. Purves, I can follow back up with y'all and get her that answer. Yeah.
Okay. All right. Well, thank you guys for your time. I hope that was helpful. I know it was a lot and I did a lot of rambling, but.
No, this was great information. We thank you so much for this presentation today. My goal is to have this up on our YouTube page here within the next 24 hours. So if people would like to watch this session again, it'll be available for them, and it'll be there for posterity, Dr. Chapman and Dr. Purves, for you to show your grandchildren and great-grandchildren someday. All right. So thank you all so much for joining us today. If you are a primary care provider in Texas and you are not signed up with CPAN, we would love to support you. It is the Child Psychiatry Access Network, available for primary care providers across the state of Texas when working with children and adolescents from age 0 through age 22. I always just think of through the first 4 years of college. If you have any questions at all, please reach out to us. We would love to support you and serve you. You all have a fantastic day and make it a great week. Bye-bye.
Thank you.
Thank you.